Hi there, welcome to my channel. It's been a while, but I'm back, and today I've got another video for you. Today it's about a few points you need to consider if you need to register with a general practitioner, a family doctor. There are a few things that I suggest you consider before you register with one. If you are interested in any content with regards to health, any content to do with general practice in particular, then this is the place to be. So stick with me, I'll be right back. So point one, you need to consider the location. So look at where is the surgery actually located compared to where you live. You don't want to be too far away from your family doctor's surgery or your GP practice. The reason being, if you were to need to go there, it has to be convenient for you. And if you don't drive, especially, even more so, why you need to consider the location of where your general practitioner is. You need to also consider, under location, you also need to consider parking. So you live in the West, you would know that parking can be a problem or it can be an issue. So please consider location and also parking when you are considering where to register with a general practice. So make sure you look at the website. Let's say you found a few surgeries close to you. Now look at number 2. Look at patient reviews. So when you go on the website of any general practice, surgery, any family doctor, there is always reviews from patients. This can be online reviews, they can be reviews from like word of mouth, people who are registered with that practice. If you know any people who are registered there could be something that would be helpful for you before you make the decision to actually register with that practice. So consider looking at patient reviews and spying a little bit on the surgery and then deciding if you want to register with them. Point number 3, depending on your medical history, it could be that you are someone who maybe requires some specialist input into your health. For example, if you are maybe someone who is diabetic and you need to be linked to a specific hospital, or you need to be linked to a specialist, i.e. if you're diabetic, you want to look at, do they have a diabetes nurse in practice? Because it would be handy for you to be able to have all your diabetes related concerns with that specialist, whether it's a nurse, whether it's actually a doctor, whether it's a physician associate, whoever it is, as long as they have the specialist there who is relevant for you, it would be handy for you. It means also you don't have to be referred on to somewhere else. You can actually have all that care in-house. And if you're maybe someone who has, let's say, you have need for a physiotherapist, check the practice. Make sure that they have possibly an in-house physiotherapist. Why? Because when they have a physiotherapist in-house, it means that you don't have to be referred elsewhere. You can just come to that practice. And if it's closer to you, that's even better. So consider what specialists do they have in-house. And while I'm riding off that, also consider what hospitals they refer to. So for example, most practices would refer to maybe 2-3 hospitals locally to them. And you want to make sure those hospitals are hospitals that you are happy to be possibly referred to if you needed it. Or if you have a preference for a specific hospital, a specific specialist in a hospital, then you might also want to consider registering with a practice that can possibly refer you to that particular specialist. And also consider your preferences also on specialization. Consider your specific needs. For example, look at the practice, look at the medical staff on there, the nurses and the medical professionals in that practice. If you are someone maybe who prefers females or males for whatever reason, for example, maybe for religious reasons you prefer females, for example. So it would be handy for you to look at the lineup of the doctors who are there, of the physician associates who are there, and any other staff who are going to give you care, to make sure that there is a female there that you can request for, because there's no point in registering at a practice which is just all males if you are someone who would prefer females. So make sure you look into the lineup. Most practices have that on their website, so make sure you know exactly who they have if you have a preference of female or male as well. Number 4, this one is a stickler in the UK, appointment availability. So in the UK, all practices do this differently. What I mean by that is the availability of appointments varies between practices. I personally have worked in 2 different practices post-qualifying, and both practices had different ways of, in terms of appointment availability. You might find that where I am now, you can request an appointment like in 2 weeks' time, but you can also have on-the-day appointments. There is also an e-consult availability. There is also the option of filling in an e-consult. Depending on what your problem is, you can do that as well. If it won't let you go through the e-consult route, then you would have to ring in. But usually, in my practice, we are pretty good at seeing patients on the same day or the day after they have requested an appointment. So I think we are great on that front. I do hear different stories from different people who are registered at different practices, but please be aware of how your practice of interest works in terms of availability of appointments. I know some practice would prioritize children, so you would find that maybe if you ring in and you have a child and they need an appointment, they would prioritize the child. But not all practices do that, so make sure you find out what your practice does in terms of availability of appointments. Number 5, find out their opening times. Find out their opening times. So maybe if you are someone maybe who works, look at maybe, are they available? Do they do after hours? Like, do they have an evening clinic? In my practice, we do have an evening clinic. We do have an evening clinic on a Tuesday. So this is mainly people who work during the day that they can request for appointments around about that time, and they can be seen. So look at your practice of interest and check if they have availability within the hours that you prefer. You might maybe prefer a practice that opens early. For example, some practices can start even at 7 in the morning. So maybe you're someone who works 9 to 5 and maybe going for an appointment in the morning and then carrying on with your day is more preferable. Then make sure you check out their opening times and make sure that they align with your possible availability for honoring the appointments. And last but not least, make sure you ask questions. I did mention about looking at patient reviews, but also ask at reception. So ask questions, ask at the reception, things like some of the things that I mentioned earlier, and anything else that I haven't covered. Try and go to the reception and ask those things and find out if they align with what you prefer. If not, then look at alternative practices so that you are at a practice that you are happy with or almost happy with. Nothing is perfect. No practice is perfect. No clinician is perfect. But if you can at least be settled in a practice that you are relatively happy with how they function, that would be helpful for your general health. And if you do need appointments and any other interventions, you know that that availability is there and that support is there at your practice. So I do hope this has been helpful. If it has, then please subscribe to this channel. Make sure you share this with others who you think might find this useful. If you are on the verge of looking for registering with a specific practice, you might want to consider the points that I mentioned in this video before you register with any other practice. Because if you register at a practice and you're not happy there, in the UK at the moment, there are waiting times for registering at a different practice because, you know, the population is bigger. So make sure that the first time you register, whether you're moving from a different country or you're moving from one location to another, make sure you do your research and follow the points that I've mentioned before you register so that you don't need to register at a different practice. So I'll see you on another video. Please comment if you found this useful. If I forgot anything or you want to add anything, then please comment down below, and yeah, let's discuss. I'll see you on another one. Take care.